Okay, we will continue on with our next interview, and we're going to have a great discussion around driving equity through value-based care. Matthew, are you on?
I am here and live.
There you are, Matthew Holt, founder of the Healthcare Blog. And Matthew, I'll let you introduce Sam, who you're speaking with today. Look forward to the discussion.
All right. Thank you so much, Lisa. Welcome, Sam. Nice to see you. I'm Matthew Holt, run the Healthcare Blog, used to run Health 2.0, spend a lot of my time wandering around the health technology sphere as a whole. And there's one area I haven't spent a lot of time about and thought about much, and I guess many of you have not either, which is emergency departments, and the way that they get scheduled and how that all works with, especially with the legislation for known as EMTALA, which means that people have to, which means the hospitals have to provide emergency care. So Sam Korsmo is the CEO of a development company called HITLAB, but they have a product called CallDR. So Sam, I want to start big picture with you, real quick. First off, this isn't an area a lot of people think about when they think about health and health technology, and change. We think a lot about clinical trials and chronic care management and all that kind of good stuff. But tell us a bit, very briefly, about some of the specific issues and problems that hospitals running emergency rooms have, and especially have with staffing.
Yes, thank you for having me. Nice to meet you, Matthew. Call is a pervasive process in every hospital in the United States of America. And it's governed by what's called EMTALA, Emergency Medical Treatment and Labor Act. It was mandated in 1986, and since then, physicians and hospitals have to provide on-call services 24/7 for anything that they may need or meet in that. A couple of big things that has developed, what we've done is really take the process, reinvigorate and re-engineer workflows that absolutely bring more efficiency to the process and allows a lot more autonomy, but also makes a lot more people play nice, so to speak.
So tell me a bit, sort of big picture. What is the sort of current state of play? You know, so I have a hospital system. I may have an emergency group of doctors. I may have a dedicated emergency room group. I may be using doctors in the community. What kind of happens now? And what's the big problem with organizing that? And then we'll talk about what CallDR is about.
The big term you just used was organizing.
Okay.
Bring, as we did at a previous symposium, herding cats is kind of what it's like. And what we've done for intensive purposes is focus on the flow. When doctors are on call, they need to be on call. So many infractions and violations in the past have been around doctors thinking their colleague or another doctor had the call, when in reality, nobody knew who was on call. And it becomes a very big issue, to the point of where hospitals can be fined up to $100,000 and doctors can be fined up to $50,000. So we've taken that process and honed in on the direct workflow of where the data starts and is originated to the point of the utilization, where, we have a cloud hosted platform that provides every aspect about the call, not just who it is and their contact information, but their credentialing. We have other processes that play into some major reduction in, reduction in phone calls. That's one of the big things we've done, well over 94-95% in reduction of phone calls. So when you have staff alone utilizing time to just contact people, we've taken that away.
So tell me a bit about the user experience. So who is the user? Is it like the nursing officer or the staffing people managing the ER and the ED? Is it the doctors and other clinical professionals themselves figuring out when they're on call? What's the actual workflow and user experience of using your tool?
Sure. Call is utilized by every stakeholder within a hospital and outside of a hospital. For instance, the ICUs, the or the floor nurses, the supervisors. With our level 2 trauma center of our customer here, we average over 7,300 logins a month by all the stakeholders within a hospital. We even have ethics that are on the call schedule, and it makes a very simple, easy application that you have either on your phone or your workstation, and you literally just pull up the call list, draw the doctor or the specialist you need, and you can contact immediately via text, email, or phone.
I see. So and frequently this would be, give me a scenario. Patient walks, patient needs a psych consult or an orthopedic consult, walks into the emergency room. What happens next? And a nurse is then trying to figure out who they should be contacting.
In the past, this is where phone calls basically butted up to inefficiency to the time. A doctor would have their nurse contact or get with the med aid, who then the med aid would get with the staff, who then would make the call to the other office for the physician on call. We don't have to do that now. The doctor can literally go right to the application itself, find the doctor, and make a direct phone call to him, an email and or a text. And it happens, let me just, what really focuses in on the scale. Imagine an ER of say a 500-bed hospital. You have 8 to 10 ER physicians in there, and they're probably dealing between 10 to maybe as many as 20 engagements every day. And imagine each time that doctor's going through that same process. We average about 4 phone calls within the ER that we say we cut out.
I see. So that's a big efficiency gain. One quick question is, how does this tie? I know that some hospitals are using things like telehealth to access outside specialists and what have you. How does this tie in with these other systems when you're looking for, say, a psych consult or a stroke consult or one of those things?
Right. We're not necessarily a consulting platform, although the original focus and the vision of what CallDR was, that was originally put in play. However, we can create those things for telehealth connections. What we found is that from an on-call standpoint with all the stakeholders, they have a faster directory. So if they want to engage another doctor that's on the directory of the entire hospital, they can do so right there with the application.
I see. All right, and then let's not end this without talking about your new news with the folks at Providence, Providence and Alaska. So tell us about what's going on there and what you're announcing about that.
Yes, our present customer has just signed a new 5-year renewal agreement with us, which means now we're moving forward in really engaging more hospitals. We are actually in 5 of the 5 facilities here in the Alaska region, and on top of that, we actually broadcast the call schedule of this level 2 trauma center to 22 of the 23 emergency departments statewide. And we are in the midst right now engaging at least 2 major health, or I should say hospital health groups. And we're excited about what's looking forward to ahead.
Fantastic. Well, this is a real brief dip into CallDR. Sam Korsmo, the president and CEO. Thank you very much for your time, Sam. Exciting to see what you're doing and how you're sort of helping solve yet another of those messy parts of the hospital, which it's as messy as they are.
Yes. Thank you so much.
Okay, fantastic. Lisa, I think we're back to you. Or maybe it's Jerry or somebody.
Awesome. Thank you, Matthew.